Hi, Paul Griffin here, MARTA's Director of Infectious Diseases, with another update on COVID-19. Firstly, I'd like to start with a big thank you to everyone within the MARTA group for the exceptionally hard work they've done to keep us in such a good position to be able to provide excellent healthcare during these challenging times. While Queensland still has excellent control over COVID-19, we've seen many examples in recent times of just how quickly this can become undone and just how close we've come to making the situation a lot worse. It's really important to remind everybody that COVID hasn't gone away, and the example of Rockhampton in recent times shows that nowhere in Australia is immune from COVID-19 and everybody needs to remain vigilant. And what that really means is keeping up the hand hygiene, the social distancing, and having a really low threshold for getting tested if you have any symptoms potentially consistent with COVID-19. Simple precautions for the prevention of transmission of COVID-19 are very important for clinical staff, not only in the clinical environment, but many other areas as well, including tea rooms and also on the transport to and from work. COVID-19 hasn't gone away and presents an ever-present risk, and so we need everybody to remain vigilant. Otherwise, a small breach in our borders, a single case that moves to another area could result in a huge outbreak that will be very challenging to contain. We also need to remain acutely aware of the risk of COVID-19 in the clinical environment, and we know how this is transmitted through droplet transmission, very similar to other respiratory viruses, and particularly as we're in the midst of our respiratory virus season, although a very minor one relatively given all the precautions for COVID-19, we need to make sure we keep doing all the simple things. Make sure we implement precautions, that we test patients as quickly as possible, and keep them in those precautions until we're sure their COVID-19 test is negative. As a provider of healthcare, it's really important that all of our staff continue to model the behaviours that we expect of everybody. And that really is around social distancing and hand hygiene, and not turning up to work if you have any symptoms, getting tested and staying home until you get those results. If our healthcare workers can set a great example, I think it will go a long way to making sure those behaviours are also present in the community, which is our most important defence against COVID-19. One of the important ways we're keeping our staff as well as our patients safe is by limiting visitors into all of our healthcare environments and making sure that we appropriately screen people that are visiting such that they're not a risk of introducing COVID-19. While currently our COVID-19 rates are low, this may not be the case forever, and so this will be an important activity moving forward, so we must make sure we continue to do this well. Once again, I'd like to thank all of our staff for the exceptional job they've done in making sure all of our staff, as well as our patients, remain protected from COVID-19. While our control is relatively good right now, this won't be the case forever. So if we can keep up the good work now, we'll make sure we all remain protected into the future.